Hello, welcome to our presentation, Epidemiological Processes of Hepatitis B, by Corey Driscoll, Logan Moody, Nathan Spears, and Bethany Hunt.
The nature, extent, and scope of the problem. Natural life history of the disease/condition. In 1885, following a smallpox vaccination campaign, an early medical microbiologist by the name of Lerman described what he called an icterus epidemic, which was the result of the inoculation for smallpox containing human lymph. Human lymph was believed to be a necessity if the early vaccination was to be effective. It would be another 90 years until the HBsAg would be identified to cause hepatitis B and another 20 years before the development of a safe vaccine, and the World Health Organization recommends to vaccinate all newborns for hepatitis B in 1992. Hepatitis B is a viral infection of the liver, which affects more than 240 million people and causing an estimated 686,000 deaths annually. Today, thanks to vaccinations, hepatitis B is a preventable disease. Some challenges to preventing this disease is that the hepatitis B vaccine is not yet widely available, which is why Asian Americans are of higher risk of carrying this disease. A person's risk of becoming infected with hepatitis B increases if their mother is from a place where more than 2% of the population is infected with hepatitis B. Asia has an infected percentage from 8 to 10% of the population. Pre-pathogenesis period. The hepatitis B virus can live on surfaces without a host for up to 7 days. The virus can spread if infected blood, mucus, saliva, or sexual fluid enter the host's mucosal membranes or bloodstream. Once in the body, the virus makes its way to the liver, where it infects a hematopoietic nucleus. From here, the virus forces the hepatocyte to reproduce itself. After the virus has multiplied, it releases itself back into the bloodstream, where it continues to multiply by infecting other hepatocytes. Pathogenic period. The manner in which the hepatitis B virus reproduces causes widespread inflammation of the liver, which can cause anorexia due to nausea, vomiting, as well as abdominal pain, dark urine, fatigue, and jaundice. Hepatitis may not cause symptoms at all in some individuals, while in others the virus may cause the acute symptoms mentioned above. The hepatitis infection can also become chronic if the HBsAg remains in the system for 6 months. Chronic hepatitis may eventually lead to acute liver failure or cirrhosis. Population at risk. The populations at risk include IV drug users, those who engage in unprotected sex, as well as those who require multiple blood transfusions. Healthcare workers are at risk for exposure due to the nature of their profession. They care for these infected individuals, which can involve exposure to used needles and blood splatter. Hepatitis is also transmitted from mother to child during the birthing process. This is why those populations whose mother lived in an area where hepatitis was found in 2% or more of the population are at risk of having contracted this disease.
Determinants that influence the conditions of hepatitis B. The hepatitis B virus is easily transmittable between people. It uses liver cells to reproduce. It forces the liver cells to make copies of itself, basically, and spits those back out into circulation, and they find other liver cells, and the process just continues. This can cause inflammation and make people very sick, but it's also important to note that a lot of times hepatitis B does not have any symptoms until the later stages, or at all. Those people who never experience those symptoms are considered carriers. Surprise, the hepatitis B virus is a virus and it belongs to the Hepatinavirinae family, and they replicate by reverse transcriptase, making them a type of retrovirus.
Nutrition. It is important that those infected with hepatitis B avoid alcohol as well as certain medications that are considered hepatotoxic. In late stages of the disease, a low-protein diet may be necessary as the liver may have trouble processing the ammonia, which occurs as a result of protein metabolism. It is important to note that adequate protein in early stages of the disease is necessary to help the liver to regenerate.
Hepatitis B diagnosis negatively affects these people's quality of life. They may lack the social support needed to cope with this disease and turn to alcohol, which only hastens the liver damage. It also affects the way they eat, the way they sleep, just the way they interact with people on a daily basis, because a lot of the time Liver diseases are stigmatized by even healthcare professionals.
Contributory data. Agent. The agent is the hepatitis B virus in the Hepatinavirinae family. Host. The host is the infected person. Environment. Hepatitis B replicates and causes damage in the hepatocytes of the liver.
Distribution patterns. Everyone has a chance of getting hepatitis B. It's spread through sexual contact and blood. It can also be spread from mother to baby. Most of our populations at risk are IV drug users, healthcare workers, patients who receive multiple blood transfusions or hemodialysis, as well as people who engage in unprotected sex. Sub-Saharan Africa and East Asia have the highest concentrations of people infected with HBV. As much as 5 to 10% of the population is chronically infected. The Middle East and India have about 2 to 5% of the population infected, and about 1% of West Europe and North America have the virus. The hepatitis B virus can survive outside the body on its surfaces for about 7 days. During this time, it can still cause infection. The incubation period on average is around 75 days, but this can vary between person to person and can be anywhere between 30 and 180 days. It can also be detected within 30 to 60 days after the infection. According to the World Health Organization, around 240 million people worldwide are infected with hepatitis B. Thankfully, in America, the new rates of infections have fallen about 82% since 1991. 1991 is the year when a national strategy to eliminate the HBV virus was implemented, and that's when we started making children become vaccinated against it. Though we've seen a huge decrease in new infections of hepatitis B, we're starting to see those numbers creep back up again thanks to the popularity of IV drug use and needle sharing. In 2014, there were 2,953 new cases of hepatitis B reported from 48 states to the CDC. This equates to about 1 person per 100,000 people. The exact number is 0.9 cases per 100,000, and this is after they adjusted for the underreporting of cases as well. Vaccination is our best bet to help eliminate this disease. It's estimated that the cost of a hepatitis B vaccine for all 3 series is about $213. This could actually prevent them from a lot more medical bills if they had contracted the virus itself rather than just get the vaccination.
Hypothesis and nursing diagnosis. The United States is at risk for increasing its new reported cases of HBV due to the alarming number of intravenous drug users. These rates can only be lowered by properly educating the public people on the importance of the HBV vaccine, how the virus is contracted, and what long-term effects the virus has on the body. It is only by educating the public on the importance of getting vaccinated and providing the means to do so, that rate of new incidents will be lowered.
Plan for control. Primary, secondary, and tertiary preventions will be provided to give knowledge for stopping the spread of the disease hepatitis B. Bringing about awareness will benefit the country and community in lowering the transmission of this communicable disease. Primary. The goal in primary prevention is educating the nation on preventing the spread of hepatitis B. Primary prevention is the most effective preventative action in controlling the spread of the disease. Immunizations, screenings and counseling for behavior change, and the use of universal precautions in the healthcare setting is a huge part of patient education. Encouraging the use of safe and effective vaccines are spreading to other countries and in more poverty locations. According to the World Health Organization, 179 countries have introduced the hepatitis B vaccine and have prevented approximately 1,307,000 deaths. Also, as of 2009, 91% of WHO member states include the hepatitis B vaccine in their infant immunization programs, and more than 70% of infants receive 3 doses of this vaccine, which provides them with lifelong protection from HBV. When giving vaccinations, it is also important to practice safe injections and use infection control precautions to prevent the transmission of viral hepatitis. Teaching should occur on reducing the number of sex partners that one may be with and should practice safe sex and use barrier protective methods such as condoms to help prevent transmitting through sexual activity. Secondary. By promoting health behaviors, healthy environments, and early screenings, this allows the detection of hepatitis in its earliest stages. At the second stage of prevention, we try to detect the disease as early as possible. Early detection allows for early treatment, which may limit progression, cure chronic hepatitis, or prevent further complications. By detecting early, this helps to limit the spread of the communicable disease and new infections, which may help protect the public, co-workers, and family members of an infected individual. Tertiary. Tertiary prevention mainly focuses on individuals with chronic hepatitis, focusing on effective treatment, limiting progressive complications, disabilities, and managing behaviors that may worsen the disease. Appropriate counseling of those with chronic hepatitis can change behavior to limit progression of the disease and reduce the cost of management to society. Primary and secondary prevention activities such as healthy eating, physical activity, not smoking, limiting alcohol, and immunizations are beneficial to those suffering from chronic viral hepatitis. This will help reduce mortality and morbidity and provide huge cost savings to the healthcare system.
Implementation of a control plan. Implementation of a control plan. If a successful control plan in preventing hepatitis B from spreading is to be implemented, there are three things that need to be considered. One is that the public needs to be involved. They should know whether or not they have the virus, and that way they can prevent themselves from spreading it to others. Another is private and official agencies. They should be really trying to sell hepatitis B vaccines. They should be kind of pushing it on people, like saying, hey, this will protect you, this will protect your family, you should get this. Maybe even mandate it. We already started mandating that children receive the HBIG within 12 hours of being born, and that's how we got that 82% drop of new incidences. There are a number of barriers to consider as well. A really big one is education. People don't know about it. They don't know how they got it. They don't know how they can spread it. So informing these people of that will help them take the precautions to protect themselves and others. Another is socioeconomic status. It is really hard to get someone to buy a vaccine if they can't afford food for their family first. So we need to ensure that this is available to them and that they can afford it. Also, that they can get there. Some of these families don't have adequate transportation and therefore are not going to use their transportation to go get their family vaccinated.
Evaluation, appropriate reports, and recommendations. Evaluation. The incidence of HBV is declining, which can be directly linked to infant vaccinations. However, with the increased rate of intravenous drug users across multiple socioeconomic statuses, HBV poses a threat due to sharing needles or reusing dirty syringes. HBV is still such a threat not only in the United States but also worldwide level. Continuing to provide education on the virus and effect to HBV vaccinations will help drive the incidence rate down.
Appropriate reports are also really important in controlling this virus. New incidences should be reported to the state health departments or the local public health departments. Another thing we need to be worried about is education. We should be educating about vaccines, what this virus is, how you get it, what it does. And a lot of people don't know that this virus can survive on the surface for 7 days outside the body. And that can be a big surprise to a lot of people. Research should really be done on a state level, because if it's done on just a national level, we won't be able to see where our problem children are. For instance, maybe as a national average, our new incidence rates have dropped 82%. Well, what if in Ohio and Indiana it's increased 96%, but in the rest of the nation it's dropping? Well, that's great, except what's going on with Ohio and Indiana? and when will that spread to the surrounding areas, and keep going and keep going and keep going. So it's also important to know why those numbers are getting that way. So is it IV drug use? Is this becoming a problem? Or is it unprotected sex? That way you can focus your education and interventions more towards the spread of the disease more effectively. The end. Here is our references.